All right, so we have the sarcoidosis. We know the patient comes to you like a young lady who with the history of coughing, as well as you've got the chest X-ray. So this is the chest X-ray. So you know that on sarcoidosis you have the bilateral lymphadenopathy, right? So this is the first thing. All right, let's just start the examination. What are you going to find on examination? To start from the head to toe. First, you might see the eye symptoms. The uveitis, it could be the anterior, it could be the posterior, it could be any other eye disorder. And then you might have and then comes to the face, you might have brachial nerve palsy. And then you'd have the erythema nodosum on your lower. And then you might find like the hepatosnomegaly. And then you might find on the chest X-ray, you might find this bilateral lymphadenopathy, and then you might find the osteopathology, these non-caseating granulomas. And then you have the history of the coughing, you have the fever, you have the weight loss, and you have the dry cough and all sort of symptoms. So you might find some heart findings, like the restrictive heart disease or like the infiltrate or stuff like that. And you have a hypercalcemia. For that, you have like the weakness because comes getting out of the bone. You might can get like the stones and blah, 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 blah symptoms. So these are the things that you really have to rule out. We know that the mnemonic was what's sarcoidosis, like each letter stands for. So you pretty much make those diagnoses. So what could be the differential? Differential could be, okay, if you have a lot of the fluid inside your heart, it's going to go back into your lungs. So you have the increased effusion around the lung, as well as the vasculature would be decreased. Asthma, we have the allergic reaction. So it's going to be the episodic. In Wegener disease, you have the nasal, the sinusitis, as well as the pulmonary problems. You have the necrosis of the vessels, you have the nodules, you have the alveolar cavitation, and then in a cystic fibrosis, what you have, let's just say we have in emphysema, you have alpha-1 antitrypsin deficiency, you have the less STs, you have the hyperinflammation. So the diaphragm would be here, so you can easily count the 10 ribs or so. And it could be related to smoking, and it could be related to the normal age, which is the standard of the pan-acinar and blah, 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 that stuff.